Hey guys, it's Shauna Danielle. Welcome back to my channel. Today's video is going to be geared toward nursing school tips and tricks. First of all, I just want to say I apologize for my appearance right now. I don't look the very best. I just finished my third 12-hour night shift in a row. I'm in my integration portion of my program where basically you just do the whole nursing schedule of whatever nurse that, like, your preceptor basically. So that's where I'm at in my program right now. So yes, I apologize that I look kind of dusty. I am very tired, and I also apologize for my voice because I don't know what I'm sounding like right now. Okay, so this video I'm going to be giving you guys tips or just what to expect when you're first going into clinicals when you first start nursing school, because it's kind of like a shock. So yeah, these are going to be some things to keep in mind when you're starting your first day at clinical. Okay, so going straight into the list of what to expect. Expect to not know what you're doing. That is number one. Expect that you're not going to know what you're doing. Don't go in there just like, oh my gosh, I don't know how to do this, I don't know how to do that, I feel so dumb. Don't, because you're going to end up beating yourself up, and it's just not gonna help you, because as you're beating yourself up about the fact that you don't know what you're doing, you are going to become more nervous and more upset, and you're gonna probably do worse. So just have an open mind and be like, okay, I'm here to learn. Like, recognize that you're a student and you're here to learn, and it's not like you're just gonna go in there and just bam, like, I got everything. I'm a whole nurse now. I know what I'm doing. Just ease into it. There's a whole transition period, like, be patient with yourself. Along with that, don't compare yourself to your peers, because they might be struggling in something else and you might be good at that. Like, everyone has their strong suits. So just work on whatever you're lacking in, and that's that. So altogether with that one, just don't overthink. Go in there, know that you're not going to be a pro. Don't compare yourself to the people in your group. Just go with the flow and be open-minded and do not overthink. Number two. So some people are just naturally really good at starting and maintaining conversations with people. It just comes naturally to them, and other people are just more shy. Like myself, I'm more shy. I don't really like to start conversations. Like, I feel awkward starting conversations, and it's just weird. So I struggled in the beginning, and still I kind of do struggle a little bit with approaching patients and talking to them, especially if I have to go in the room to do something and then it's just awkwardly silent, and I'm like, okay, I feel like I need to say something. So how you feeling? Fine. Oh, that's good. Okay, can I get your arm now so I can put the blood pressure cuff on? Like, I just feel so weird sometimes, and that's okay, because again, like, as you're there more and more, you become more comfortable in talking to the patients. Also, my suggestion for that issue is to definitely write down what you plan to do when you get in the room, because sometimes you'll go into a room and forget something that you were supposed to do, and then as soon as you leave the room, you're just like, oh, I forgot to do this and that. I don't want to go back in there. It's just so awkward. Like, I suggest writing out what you plan to do when you get in the room, and as you're going through whatever you're doing, you could just take a second and look back at your list of things that you wanted to do and make sure that you covered everything, instead of leaving the room and being like, oh, damn, I gotta go back. And also, some things that I've done, because I'm so awkward with conversation and I just be forgetting what I want to say, I actually have planned out and kind of ran through what I wanted to say with the patient as well, because I have anxiety. Like, I want to run through how the conversation's gonna go on my part, and yeah, that's actually really helped me to flow better with my conversations with the patients. If you have trouble talking to the patients, I think you should maybe recite certain things that you want to say, brainstorm things that you want to say. I've written things down before, questions to ask. I've just kind of recited it in my head, not like sitting there talking to a wall or whatever, but you know. And then like before entering the patient's room, I would like take a deep breath and just be like, okay, and then just enter. So I think that that helps like calm your nerves and prepare you to actually face your patient and have a meaningful and like fluid conversation without like it being awkward on anyone's part. Another big tip is to explain to your nurse what you can and can't do. Like, explain to them where you are in your training. Don't just, because sometimes they think that you have done whatever before and they're gonna give you this responsibility to do, and you're just like, whoa, like I don't even know what that means. Like, so just let them know, yeah, like I haven't done this or that before, but like if you can show me, and then like the next time I can try it, if you're allowed to. It depends on what it is, because certain things you can't do. Yeah, or like I can do vitals for you, and I can whatever. Like, just try to be open with your nurse and let him or her know where you are in your training. Also, research like abbreviations, terms, disease processes. Research anything that you come across during clinical that you don't know what it is, what it stands for, whatever. Sometimes, depending on your program, like you'll have post-conference, like after your clinical hours, you guys might talk about your highlights, like the highlight of your day or something that you learned today or whatever. And that could be something that could be interesting to the rest of the group. And it could also show that you are taking learning into your own hands and you're actually looking up things that you came across and you found interesting. And that might give you some, you know, brownie points with your clinical instructor, like, oh, this student has initiative. I like her. Okay, also, if you have a chance, like while your nurse is charting or something, you should look at the chart, because in those orders, you're definitely going to see medications that you're not familiar with. You can write those down and research them, and it's likely that you're going to come across the same medications that you're going to hear about in pharmacology, which you may or may not be taking at the same time, but it'll help you in pharmacology. It'll like connect the clinical and the didactic courses together and make things more relevant. So definitely try to get familiar with the medications that your patients are on, especially if you're on that same unit for however many weeks. Like, you might see the same medications again and again. So I mean, it only makes sense for you to know what that medication does in the first place, because why is everyone on this medication? Next super tip, get this clipboard from Amazon. This is super duper clutch, y'all. Like, this is real clutch. Let me tell you. They have the, what do they call these again? Fish bones. It has all the values, all the normal ranges, like sodium is 135 to 145. So all these normal values are just sitting here, and it fits in your pocket. For your scrub tops, these pockets, it fits right in there. That's where I hold mine. Then they have like the different pupil sizes. They have normal ABG values. They have injection sites here. And on the other side, they have a pain scale here with faces. They have conversion, like a conversion chart for height and weight. And I definitely think that you should get it. Oh, and also has like a ruler on the sides, both sides. Okay, another very important thing is to know what you are and are not allowed to do on the floor. Like, most likely you're going to be told this like by your clinical instructor the first day anyway. Giving medication, you are most likely not allowed to do when you first like start clinical. You can't give out meds. Definitely be aware of what you can and can't do, because you don't want to do something that you're not supposed to do. Also, another thing that can happen, you could be like, I don't think I'm allowed to do that, but your nurse is like, oh no, it's fine, you can do it, like I'm standing right here or whatever. And that's very tempting, but it's like, if something goes wrong or if your clinical instructor finds out, your nurse is not the one grading you. Your nurse is not at all like dealing with your school. It's your clinical instructor who's going to give you the grade, and they are most likely going to snitch on you to the school and be like, yo, she gave out a med. she can't do that, and you are going to get in big trouble. Another tip is to, like, if you have time, get familiar with the supply closet. Like, go in there and look around, see where all the like tools are, and if you don't know what that instrument is, like, look at the name, look it up, figure out what it's used for, and try to get a sense of where things are placed in the supply closet. You don't want to be like in the middle of like a dire emergent situation and your nurse yells out, "Go to the supply closet and get me whatever whatever," and you go in there and it's like, what is it, whatever whatever, or where the hell is the whatever whatever, I can't find it. Like, so try and look around in there and try to get a sense of what's in there. Don't hide out in the closet though. Another thing is, expect to be doing dirty work. Expect to do dirty work. Don't be like, oh, well, you know, I'm not a nurse tech or whatever. Like, they do that. There was this girl in my program who did that. Sis, first of all, you're a student. The techs are higher than you. Like, don't be so like stush and like standoffish and like you're superior. Like, no, the nurses actually do dirty work. It's not just the techs. Don't be like, oh, I'm not gonna be doing that. Don't go in there expecting not to get your hands dirty, because you will. You will get your hands dirty, and possibly your shoes. Next tip, even though it sounds so obvious, drink water, use the bathroom. It is so easy to forget to do that. And then you're so dehydrated, especially when you first start and you don't really know what you're capable of. Just keep in mind, okay, right now I'm not really doing much. I don't really feel that thirsty, but you know what? Let me actually go take a sip of water. Because then when stuff hits the fan and y'all are running back and forth and you're just like, oh my God, oh, I need some water. Like, you need to have some type of hydration in your system for that shift. And along with that, you know your own self. Like, if you need to eat breakfast in the morning to function, don't skip breakfast for clinical days. Don't skip breakfast. Me personally, I don't eat breakfast because I'm naturally a late riser. Like, I don't like to wake up early in the morning. So I don't usually eat so early, and I commute like very far to the hospital that I'm at, to my school even. I'm 2 hours away. So when I start clinical at 7, I leave my house at 5, so I have to wake up at 4 in the morning. Okay? I am not eating breakfast at 4 in the morning. Like, I'm not doing that. And we would get off of clinical at 12 for lunch. And so then I would have my breakfast. But you know yourself, if you can't function and be running around with nothing in your stomach, you need to eat breakfast, and don't skip it. Even if you like wake up late, just quickly order something from like a deli, and on your way to the hospital, just stuff your face. So as we're talking about taking care of ourselves, definitely the night before clinical, have a good night's sleep so that you can be more active and alert and more like present when you're at clinical. Besides sleeping, definitely prepare your bag of whatever you're gonna need for that day. Like, print out your S-bars, have your clipboard, your handy dandy clipboard, your pen light, tape, scissors, whatever you're gonna need, your stethoscope, of course, don't forget that. You need to have your ID. This picture is so annoying, as every ID picture is for like everyone in the world. Have your ID, because if you're unprepared for clinical, like, you can like really get points taken off. And it's like, for my ID, bro, like, it's right on my dresser. So you don't want to miss points for that. So just pack everything in your bag instead of being like, oh, I'll remember in the morning. Just pack it. Just pack it all. But yes, I think those are all the tips that came to mind so far. So definitely good luck to all you guys who are starting like nursing school, starting your clinical soon. Breathe, relax, you're going to do amazing. Also, if you're a nurse or a nursing student or any kind of student where there are clinicals and you have some tips and tricks to share with people who are now starting clinicals, you can add your tips down in the comments below. Let me know what you guys think about the tips, and if you have used them, then how has it worked out for you. So definitely comment below, and if you like this video, give a big thumbs up, and I hope to see you guys in my next video. So now I am going to go take care of myself. I'm going to hop into the shower and go straight to sleep because I am tired as hell. So see you guys in my next video. Bye.